Hey, this is Bob with PEAK Med. We're doing a quick evaluation of this tray to look at see if everything's here, which it is. In addition to that, how good a shape this retractor is with blades and everything else. Basically, what this is a CT 100 Mod 3 RO3. Basically, what that means, the Mod 3, is basically manufacturer has taken and welded each one of these hinges right here so that you don't get excessive kickback on the rack when you're basically moving this with a lot of force within the incision and also pushing it outside. But let's look at the rack itself. The rack itself basically has a thumb screw, which needs to be intact, should be fairly loose. In addition to that, make sure that the back of this thumb screw has this part on it right here so it doesn't out or exit freely. So from that perspective, you look at that. Also, it should move freely with moving in 1 to 2 millimeter increments so that it opens well. Putting some pressure on it, feels good. It's locking well. So from a locking perspective, you have this latch right here which holds it. It springs open too, so it's got a nice spring on it. Nothing's loose right there. In addition, we've got the ever-present pivot screws. These pivot screws move in a direction so that it's clockwise. It'll push out the blades, of course, and when you push out those blades, you gain more incision visibility with that. So you want these blades to be able to move out, move in, but that's how we work with that. Sometimes what you'll find out is that the lack of oil in this more or less does not allow these to twist too well. So the recommendation here is, and what I've done is basically take a little bit of oil and your LS 0451, which is your crank for your thumb screw, and just oil it 1 to 2 millimeter or 1 to 2 degree increments basically, and then go 3 to 4, and you'll see this loosen up. And then you go 4 to 5, 5 to 6. Be very, very patient. Sometimes it can take up to 5 to 6 minutes to get this fully free and loose again. But once it's loose, it's fine. Just make sure when you back it out all the way that the screw doesn't back out itself. Got to be very careful of that. And that should be a point well taken also in CS too, central sterile. So that right there more or less looks at the retractor. Now let's look at the blades. From the blade standpoint, as we are aware, basically there's high tolerance on these blades, so you don't get a lot of movement. With that said, basically I check the blades to make sure that there's no movement within the blades themselves, because sometimes when people take these blades out, they twist them out when they should be just pulling them straight out. So check each blade to make sure that each blade is intact and doesn't twist. There you go. So we'll be good with that. So this tray looks like it's in good shape, ready to go, well oiled, clean, dry, sterile, and it's for use. I'll take it to decontam and they'll put it back in action.